The coronavirus pandemic will be a huge human tragedy that Africa has never faced. We are not prepared to address it. When I see what is happening in better equipped and more developed countries, I fear so much for Africa. Thousands of people are passing away. Hospitals and other health care facilities are missing protective material and other equipment. When I see this happening in Europe or America, I realize that we need to do our best to prevent monumental disaster. African countries are less developed and very poor. About 80% of its population has less than $2 per day to live on. Healthcare facilities are poorly or not at all equipped. Overcrowding is a rule. People's daily struggle for survival will double with coronavirus. Confinement is impossible to implement. It will be a hard choice between staying at home to die slowly of hunger or go outside to look for food and risk getting contaminated or contaminating others. In such situation, people will prefer breaking confinement measures to survive with their family. The only viable strategy in Africa is prevention, and again prevention. Compliance with hygiene measures such as washing hands regularly, avoiding crowds, keeping distance between one another, using masks and gloves, etc. We need to go beyond that by testing and identifying systematically the suspect cases in order to isolate them and just put them somewhere when they can be secure. Since our medical facilities have limited capacity, we need to reduce the number of people to receive at the hospital. But above all, we need to get tests, which unfortunately we are still missing. Based on what has happened elsewhere, Africa should develop a strong preventive strategy.